pain in the first stage of labor is caused by uterine contractions and dilation of the cervix. It feels like cramps coming from the uterus, cervix, and is referred to the whole abdomen and thighs. Whereas in second stage, when the baby has to come out, pain is a combination of contractions, cervical stretching, and distension of vaginal and the perineal tissues. There is also an urge to bear down and push the baby out. Different pain relief options are non-pharmacological, which doesn't involve any medication, and pharmacological, which involve drugs to relieve the pain. Non-pharmacological methods don't involve any medication. The basic purpose of using these methods is to increase your threshold for pain and also increase the capacity to cope up with the pain. Pain is not going to disappear, but using these methods you can get some personal control over the pain. Some baseline things you can do is to educate yourself as much as you can. Figure out different pain options available and then stick to the one that you think will suit you during labor. Different non-pharmacological options you can try are comfortable birth environment, different positions during labor, breathing and relaxation techniques, water birth using aromatherapy, or elective nerve stimulation or self-hypnosis. Try to have a calm, private birth environment with a good supportive partner like a doula or a midwife. Your friend, husband, partner, or any other family member can be your support partner along with the doula. It has shown that birthing environment and positive influence from the supportive partner makes a lot of difference in the birth outcomes. Try to move around during labor. This will not only divert your attention, but will also help to keep the baby moving down in the pelvis. You can use birthing ball, mats, bean bags, birthing stools. Benefit of using these different positions are that they are easy to use and they help in baby moving down in the pelvis. They also shorten the labor and they can be used along with other pain relief methods. The disadvantages are initially you will feel good, but later on it becomes very exhaustive to use these methods. You need a very good support and encouragement to try different positions all the time. You will not get rid of the pain completely using these methods. Hand-holding, patting, stroking as a gesture for support is welcomed by some women but irritating for others. And same holds for massage as well. If you are unsure you would like to be touched or massaged, you can try with the foot massage first. If you find it comfortable, you can always go ahead with it. Massage of soft tissue decreases the muscle tension and might help in relieving the pain. Relaxation techniques involve breathing techniques, meditation, or massage, and you can use the same methods you learned during your labor classes or during yoga classes and implement them when you are actually in labor. It can be practiced in your home while waiting to go to hospital or even in the labor room of the hospital. You can also use them with other pain relief options, but with the relaxation techniques, the pain will never go away completely. And you can use only these methods if you have practiced them during your pregnancy. Heat packs, warm bottles, or electric heat pads are also used, but very few studies prove that the heat application is an effective option. Auditory stimulation as music or sound can be a pleasant distractor to decrease the pain perception. Hypnosis is an altered state of consciousness that prevents the normal perception of pain during labor. There are specific classes available for hypnotic birthing, where a trained teacher teaches about self-hypnosis, and then you apply the same technique when you go in labor. Many women love water birth, and it has also shown to increase relaxation and decrease the labor pains. Guidelines recommend water birth can be taken by anyone having a low-risk, uncomplicated pregnancy between 37 to 41 plus 6 weeks of the pregnancy. Remaining in water for more than 2 hours has shown to lower the uterine contractions by decreasing the release of hormone oxytocin. You can use birthing pool if it is available in your hospital. It relaxes you and your contractions are less painful. Temperature of the pool is monitored and is normally kept around 37 degrees. Though it decreases the intensity of the pain to some extent, but you can only use if your pregnancy has been completely low risk and you have no contraindications to go in the pool. All this will be discussed with you by your doctor whether you are suitable for water birth or not. Many studies have reported that relaxation, breathing, and posture techniques taught in yoga have decreased anxiety, pregnancy discomfort, and stress during labor. Aromatherapy. As the name states, essential oils can be used for massage or inhaling. Various oils available are CLARY sage. It encourages regular contractions. Jasmine and rose. It will decrease the anxiety during labor. Lemon is used for uplifting mood in labor. Peppermint can relieve nausea and vomiting. Aromatherapy increases relaxation. It helps in decreasing pressure on your tummy and will also relax the perineum. But if you are allergic to specific oils or have asthma, best is not to go for aromatherapy. Pharmacological options in labor involve analgesics, Entonox, which is gas and air, local injections, sedatives, and regional blocks like epidural anesthesia. Entonox is also known as gas and air. You can breathe in gas when the contractions begin and stop when the contractions stop. You can use it anytime during labor, but it can make you feel lightheaded or sick at times. Epidural anesthesia is a more complex form of pain relief. Anesthetic drug is given through a small tube in the back. This small tube is passed in your back near the nerves which carry the pain from the uterus. It is the most effective form of pain relief, but it can cause you headache, tingling numbness. Sometimes you can get pain around that area where the epidural was inserted. You can also have itching around that area. All these side effects are very rare, but they can happen at times.